My name is Alan Labbitt. I'm a veterinarian and I'm self-employed. When I first started my business, I had shopped around for different health insurance. I joined the National Business Association in order to get the lowest rate I can get. Being part of this big group was a good thing at that time. Since that time, I have rode the elevator up with premiums. I was paying $2,100 a month for me, my wife, and my daughter with a $5,000 deductible. I had to go to that $5,000 deductible from a $2,500 deductible just to keep the rate at the $2,100 a month because we had a birthday and the rate went up again. I tried to get other insurance at a more reasonable rate, and either I was told that they wouldn't cover me because of pre-existing conditions, or they would cover me but they wouldn't cover the pre-existing conditions, which also meant the medications which I was getting under my insurance plan, for a year. Or else one group did take us in, except that they had a 50% premium on my policy because of pre-existing conditions. So I ended up keeping the insurance that I have simply because it is a known entity. It's a good insurance company, but it's just getting awfully expensive. If I didn't have coverage that would also cover my drugs that our family is on, the drugs alone I figured would cost about $14,000 a year in addition to my premium. So I'm kind of locked into having insurance that would also have a drug policy to it. What I would like to see is more choice, some way of being able to maintain my health, my family's health, with affordable insurance and affordable maintenance medications. I'm healthy. I run 6 miles every few days. I ride my bicycle to work, which is 9 miles away. I haven't been to the doctor in years, but I'm paying just extraordinary amounts on my insurance, and if I was sick, I don't know where this would all go.
My name is George Krause. I am a self-employed individual with several entities that I work with. Problems that I have had with health insurance have been a lot. It goes all the way back to about 2001, when I found that all because I either, one, do not fit the criteria of the insurance companies, be it weight, height, certain medications that I'm on, or medical incidents that have happened, even though they were not long-term, I would be denied health insurance. So, according to the rules of the insurance company, you have to be denied three different carriers to be denied to get the state insurance, which is called iChip. Okay, so I subscribed to iChip. I understood that it was 135% of the normal rate for a person my age, but I accepted that. But after a while, the premium kept increasing substantially every 6 months. And in order to keep the premium reasonable, you had to select a higher deductible. So it was up to $2,500 deductible just to keep the premium at a decent level that was affordable. I've never been hospitalized at all. So I said, well, after a couple of years of this crazy increase, I just said, and I looked at what I was spending or not spending, that I said it wasn't worth carrying the iChip because I would have to spend so much money before the insurance would even kick in. So I might as well just pay it out of pocket, which is what I've resolved since 2004. I just said, forget it. I'm out of the health insurance market. I'll just have to pay cash for whatever I have to do. At one point, my medication was running me about $200 a month. I had been blessed with working with my medical providers because of self-pay. They try to give you a little discount, even if it's 25, 30%. Some have given me a 50% discount. So that has helped with checkups and tests. But nonetheless, it's still a shame that an average self-employed person, all because of technicalities, in their eyes, cannot get adequate health insurance, and therefore forced to pay out of pocket.
My name is Cheryl Glick, and my insurance nightmare started almost 7 years ago when I lost my job and could not afford to take COBRA. And so I turned it down, and then I was hired at a company that did not have a group plan. And they put me in touch with their insurance agent, who said, I've got the perfect plan for you. And he put me with what turned out to be not an insurance policy. It turned out to be an indemnity policy where they discount things, and I was led to believe that they would pay towards something, and they did not pay anything, and continued to not pay anything. And shortly thereafter, I was diagnosed with high blood pressure, and my doctor was sending me for all kinds of tests that I was assuming was being paid for, and it was not. And I wound up having to pay for everything. And I wound up about $5,000 in debt. And then I reached the breaking point, and I went and talked to my employers. First, I called my own insurance agent, and he found me a policy. I went and talked to my employers, and I told them what was going on, and that I had found a policy on my own if they would be willing to contribute as they were on the other thing. The policy was with American Medical Security, which I continued with. It's a good policy. They agreed to accept me with knowing that I had high blood pressure and not using this pre-existing. And I continued with them for a couple of years, and then they were bought out by United Healthcare. And it turned out that none of my doctors was on United Healthcare, nor was the hospital that they were connected with. So my insurance agent found me another policy with the same network, but they would not accept me with high blood pressure without it being pre-existing. So I continued, and I had to see my doctor every 4 months, and she was getting paid, but I had a rather high deductible, so my $5,000 debt was increasing. I continued with this new policy and they increased it every year when it came up for renewal. And in order to keep the premium low, I had to go with a higher deductible. And I kept going further and further into debt. And once again, I'm at the point where my insurance agent is now looking for yet another policy for me, because I am now paying almost $1,800 a quarter. I need to have something so that I can get myself out from underneath. And I'm hoping that somewhere down the line, we will have universal health care. I mean, we have other countries have it. Why can't we? Why should we be suffering?